So in this video we're going to talk about looking at hip range of movement, particularly rotation of the hip joint, and see how this relates to groin pain. Now the first thing is groin pain obviously is a very complex issue and can be caused by many different things. One of the common misconceptions is when people talk about, oh, I've got arthritis in my hip, is they often think it's where their hip is, and actually they're often on their pelvis. In fact, actually the groin itself is where most of hip joint pain tends to arise. So whether it be arthritis of the joint or maybe a labral tear or whatever. What's interesting though is looking at the rotation has been shown in this research to have a very good correlation with the potential for getting groin pain. What they found is the total internal and external rotation of the joint while the hip is in 90 degrees flexion is 85 degrees of total range. So obviously this is within the internal and external, so this could be like 40 degrees, 45 degrees, or something to this end. It doesn't quantify it as to the exacting how much internal or external that there actually is, but basically this does have some correlation to groin pain. Obviously groin pain, like I said, can be many things. One thing that's been said for a while is that your internal rotation loss has a very good correlation with osteoarthritis development, and they actually look at this as a screening tool within even young footballers, where they look to see if they flex their knee up towards their chest, i.e. flexing their hip. If the knee kicks out a bit, which means the foot turns in, which is very much a little bit of internal rotation loss, because they're actually going into external rotation because there's no range to be had. And this is something I've said a lot of times to patients as well, as if they're losing internal rotation. Obviously this looks at total rotation, but that also includes internal rotation. So it is interesting. That means if you have a look at your hip range, and like I say, flex at 90 degrees at the hip and knee, and then turn your foot inwards and turn your foot outwards at rotation, and see if you've got generally about 85 degrees or more. If you're deficient in this could be a good idea to stretch that out. And I would say you're looking for a bit of a, not an exacting balance, because you should have more external rotation than internal rotation. But say if you work to say 40 degrees, 45 degrees ish, so 45 degrees of external rotation, which is where your foot turns inwards relative to the knee, and external rotation is where your foot turns outwards. So you're looking for maybe 40 in that direction. If you've got that or above, then your flexibility is good, and therefore not really something to think about. But it is interesting that this research does highlight that there is definitely some correlation between total loss of rotation of the hip and development of groin pain. Whether that's arthritis, it doesn't really detail, but there's a very good shout that there could be something related there. So anyway, that's it for this video, and I'll see you next time.